Hello, everyone. My name is Ashley, and with me today is Jewel and Brody, and we will be presenting antisocial personality disorder. So antisocial personality disorder is a mental health condition in which a person has a long-term pattern of manipulating, exploiting, or violating the rights of others. This behavior is often criminal. The causes of antisocial personality disorder are unknown. Genetic factors and child abuse are believed to contribute to the development of this condition. People with an antisocial or alcoholic parent are at increased risk. Far more men than women are affected. And the condition is common in people who are in prison. Fire setting and cruelty to animals during childhood are linked to the development of antisocial personality disorder. Some people believe that the psychopathic personality or psychopathy is the same disorder. Others believe that psychopathic personality is a similar but more severe disorder.
In our given case study, our patient displayed a wide variety of unique symptoms that co-align with many of those who suffer from antisocial personality disorder. Our patient was a grad student and teaching assistant for his college, and as well as attended a college counseling clinic, or in his own words, was because he was interested in personal growth. So he sounds like the perfect student so far, but it's revealed in this case study that the counseling was actually required by his academic advisor, and the teaching assistant job came from him exaggerating his qualifications. Our patient was able to get by with these lies in his social circles because he was witty and charming and good at giving people false perceptions on himself. So he was very deceitful as well and good at manipulating other people's views on him. He was good at, for example, our patient has been caught cheating and plagiarizing work, but has always been able to weasel his way out. Our patient as well states that he heavily drinks due to past trauma and also dabbles with marijuana. Now, since the case study is done from a perspective of someone looking in on his life, we aren't necessarily sure if he is being 100% honest with him saying he just dabbles in marijuana or he has tried it before, because with people with antisocial personality disorder, lying is very common. Those with antisocial personality disorder are also known to break the law repeatedly, as well as disregard safety for themselves as well as other beings. Throughout our patient's assessment, it revealed that he was in a juvenile detention center due to killing a neighbor's dog in a very disturbing way, as well as committed several other crimes such as theft and vandalism. He constantly says he commits shoplifting crimes. He likes to brag about it with his friends. So this is something showing that he does not feel any guilt, any remorse for his actions either. Patience is often considered to be cocky, arrogant, or overconfident by others, which are also big indicators of a person suffering from this disorder. For diagnosing antisocial personality disorder, the patient must undergo several different types of tests and evaluations to rule out the possibility of the patient's symptoms being derived from other factors. Normally, to begin, the doctor will send the patient to get blood work done. This would include a urine sample as well. This is to be sure that the root of the symptoms isn't coming from any organic factors, such as problems stemming from the internal organs or other chemical processes that happen in your body. During the initial appointment or during one scheduled after the blood work is reviewed, the physician will do a routine physical exam, check you top to bottom to make sure you're physically sound. This ensures that the blood pressure, breathing, and everything is all normal, as well as the physician will search for any irregularities on the outside of the body or pain. After these two are performed, the doctor will refer the patient to a psychiatrist or psychologist to perform a psychological evaluation to study possible underlying causes of the symptoms, which very well may be stemming from a different disorder entirely. The person performing the evaluation will also review past medical records to find patterns in the behavior. So the process of getting diagnosed with this disorder can take some time, and there are a lot of factors to rule out.
Just in continuation to diagnosis, a person can be diagnosed with antisocial personality disorder only when they are 18 years of age. A patient must also have evidence of having conduct disorder before the age of 15. And since someone with antisocial disorder shows no regard for right and wrong and does not take into account the feelings of others, people who has this disorder would repeatedly break the law. They con and they lie to others. They would also show irritability and aggressive behaviors, therefore resulting into involvement in physical fights and assaults. They also feel no remorse when harming others. They disregard the safety of others and themselves, and they would also act impulsively. Next slide, please. So just the management of antisocial personality disorder. This is one of the difficult personality disorder to treat because it can be similar to other disorders like substance abuse disorder, narcissistic personality disorder, and as well as borderline personality disorder. There are no medications approved by the Food and Drug Administration to treat antipersonal disorder, which is also plays a role as to why it is a hard disorder to treat. Although this is the case, doctors can prescribe medications to patients for conditions that are sometimes associated with the disorder, such as anxiety or depression or aggression. And the treatment for antisocial personality disorder is also heavily dependent on a person's willingness to participate in treatments and an individual's severity of symptoms. And then just on the last page, we just have our references, which then concludes our presentation. Thank you.